Hello, I hope you guys are doing well. We are going to talk about lymphatic disorders today. So first we'll look at the anatomy, and I can put this YouTube video in the play pause it link. We have lymph nodes all over our body. So we have the majority of our lymph nodes are in the abdomen and along the proximal areas, the proximal joints of our body. So shoulders, hips, as well as our neck, and a few up into our head. The lymphatic system gathers fluid and drains it to maintain good blood volume and to help keep a healthy blood flow. So it should remove some toxins and then send the healthy fluid back into our system to be recycled. And that is what the lymphatic system does. Observation. So when we are working with a patient who has a lymphatic disorder, let me go back to the one before. Essentially what happens is the lymph nodes themselves get either overwhelmed, there's too much fluid come to them, or they're blocked, or maybe they've been removed surgically or something, and fluid starts to gather in an area. It gets backed up down the system, and you see significant inflammation. The lymphatic system is very important with our immune system, with helping catch and remove toxins or irritations, but it also plays a role in spreading infection if we do have infection, such as cancer. If it gets into the lymph nodes, then it can spread throughout the system. So you have to be careful, and that's one reason they would remove lymph nodes in a cancer patient. But if somebody comes to you and they've been diagnosed with lymphedema, that would be swelling throughout the lymphatic system. Typically, it's in one area specifically, not the whole body, but maybe an arm or leg or both legs, something like that. And the remainder of the lecture will be kind of how we deal with patients who have that diagnosis. Lymphedema is a diagnosis. So observation. We observe the skin color. Is it shiny? Is it red? Is it purple? The texture, the location of the edema. We look for any wounds or scars. We document the size of those wounds or scars, so we make sure that they're getting smaller and not larger. And then we measure the girth. So you take a measuring tape and go around kind of the largest area, and that would be your girth measurements. And all these are recorded so that you can compare from one treatment to the next. Is the patient improving or not? And, is the treatment effective? Different types of swelling. So pitting edema is where you press on an area and an indentation remains in that area for more than 3 seconds. That is called pitting edema. We do check for that. And if it is more than 3 seconds, it's kind of abnormal. If it's less than 3 seconds, it should be normal, and they don't have pitting edema. With brawny edema, that's when there's swollen areas that feel hard. And that tells you that there's been edema in this area for a long time, and now the tissues underneath that area have started to change and become more fibrotic, and that's what causes that hard, scaly kind of texture to that area. That's brawny edema. So hard areas that have had edema for a long time. Weeping edema is like kind of a wet edema, so there's fluid leaking out of the skin, and it is also from long-term edema. There's been some tissue changes, and the pores are allowing liquid to leak out. It's a sign of severe lymphedema, and it's also bad because it could allow infection to get in. Palpation, when we are doing some palpation with these patients, we want to feel the skin and see, does it feel wet or dry? Does it feel soft or hard? Is it smooth or bumpy? And record all of those things. We also want to record what areas they have that are tender, if there's any areas that there's decreased sensation. And then we check for a stimmer sign. So a stimmer sign is when you pinch skin, you should be able to pull some up. You pinch some skin, there's some skin that you're able to pinch up. When you go to pinch some skin and no skin is able to be pinched because it's hard and stiff, that is a positive stimmer sign, and that indicates that they have a stage 2 to 3 lymphedema at least. So that tells you the edema is significant enough that it's affecting the skin turgor, and it may be even changing the dynamics or the makeup of the skin underneath. The tissue changes may be already occurring. That would be stage 3. So what are the stages of lymphedema with a stage 0? That is, and underneath it says 1, 2, 3, 4, but the way the book says it is 0, 1, 2, 3. So 0 is occasional heaviness in an extremity. So sometimes it feels heavy, it feels swollen, you go to bed or you lay down or sit with your legs up and it goes away. 1 is called reversible lymphedema, and the swelling is still soft. It can be pitting, but when you elevate that extremity, the swelling decreases and there have been no fibrous changes of the tissue. So the tissue makeup is still the same, but the edema is staying in the area more and more often and causing pitting edema. If you lay with your legs up, prop up for a little bit, then it is reversible. With stage 2, which is marked as stage 3 in the picture, it's called spontaneously irreversible. At this point, swelling is no longer pitting. The tissue fiber begins to change. It begins to be brawny, hard. The tissue starts to proliferate, so more tissue is made, so it's getting larger at a greater rate. They have a positive stimmer sign, and they're at a higher risk of infection. Remember, when fluid just sits in an area, the toxins in that area are not removed, and the good nutrients are not allowed to come in, and that sets you up for an infection, increases your risk of infection. And then with stage 3, it looks like stage 4 in the picture, but it is stage 3. It's called lymphostatic elephantitis. And I'm sure you've all heard of elephantitis. This is when you have a significant increase in lymph volume. You still have a positive stimmer sign. There are still skin changes noted, like the hyperkeratosis, like it's an increase in skin pigment, so the color changes, papillomas, deep indentations, and hard areas, bumps and things in the skin. Deep skin folds can be present. And even the skin and the nails are likely to get infected, and you will see some changes in the nail beds as well. What can we do to reduce the risk of lymphedema, especially if you see maybe it runs in my family, so I need to make sure I don't get it, or I'm starting to notice more and more swelling in my legs. What can you do to keep it from getting worse? Whole body movements are key. Elevating the limb that's getting swollen is key. You do not want to do vigorous, repetitive straining activities because that actually increases inflammation. So you don't want to do like jumping and hard hitting or things like that. Compression garments are really good to be worn in order to increase the fluid return to the heart, decrease the gathering of fluid in a limb. You do want to avoid restrictive or banding clothing that can actually decrease the venous return and cause more swelling below that area. Manage your diet. Doing a low sodium diet would be key. And drinking enough fluids, things like that. And then have any blood draws be done on the uninvolved limb. So if one arm is swollen, then anytime you're doing blood work or taking blood pressure, it would ideally be in the other limb. I personally, we have lymphedema in our family, and my mom was going through PT getting some for lymphedema, and my sister and I started realizing we already had stage 1 and 2 lymphedema in our legs. And so both of us have kind of changed our diet and our exercise habits and stuff to try and decrease its progression. And I, over the past year, have noticed a significant improvement. I was noticing every day, by the end of the day, my ankles were just like huge. I had all this swelling in my legs. And in the morning, so my legs look like a whole new person. But over time, with exercise and eating better, and for me, these supplements I've been taking have been life changing. But it has taken that inflammation out, and now I can't think of the last time that I noticed any swelling in my leg. So it really is reversible when it's stage 0 or 1. But once we start getting those tissue changes, then it's not reversible. You can do some things to keep it from progressing, getting worse, but not reversible. Skin care. When you have lymphedema, this is really important because you're at a high risk for infection, but also for skin tears and abrasions, openings in the skin. So you want to make sure the skin is clean and moisturized. So moisturize with lotion, but not wet. Like you want it to still be dry. No wetness just sitting on the skin. That causes skin breakdown. If you see damage, you want to immediately attend to that. Protect the hands and feet by wearing socks, gloves, shoes, especially when you're using chemicals like cleaners and things. Be cautious when you're cutting your nails or shaving or doing any of those things so that you avoid cuts. They're going to have a harder time healing and increased risk of infection. In the same category, use a razor, electric razor, rather than straight razor to avoid cuts. Avoid hot baths or shower. Remember, heat increases inflammation. So if you're taking really hot showers or things, getting in the hot tub, things like that, that's going to increase swelling. And then if you notice that you have any signs of infection, like a fever, redness in an area, fatigue, nausea, heat coming off an area, then I would notify the medical doctor, or if the swelling's getting worse and doesn't resolve within 1 or 2 days. Now, sometimes you'll have good days and bad days. Like, let's say you go somewhere and stand all day, you're going to have more swelling in your legs, but it should resolve within 1 or 2 days. And if it doesn't, it's time to contact your doctor and make sure everything's okay. Compression. There are various compression garments. You could just use like a stretch band, like an ace wrap or something like that, and do compression. It needs to be even, and there needs to be no wrinkles, no areas where it's bit or folded in, because that can create skin breakdown. So the compression needs to be even and needs to be worn at all times other than bathing. And the bad thing about ace wrap is as you wear it, especially when you're moving around, it becomes looser, so you have to kind of re-wrap it several times throughout the day. Or you could get a custom compression garment made. So they take measurements and order it, and it comes directly to your size, and you can just slide it on and slide it off. They're a little bit hard to get on and off, but they give you a more constant and sustained amount of pressure throughout the limb and throughout the day. It doesn't loosen or fold in on itself or any of that. They can be expensive, and as the swelling goes down, you would have to order a smaller size in order to still have the right amount of compression. These typically are worn throughout the day and removed at night. There are some other things that you can do, like some taping techniques that can help decrease edema, and exercise, different things like that. But compression garments are key in keeping the edema low and keeping it from progressing. Manual lymphatic drainage. This is something that we as physical therapists can do in order to increase the fluid flow, decrease it backing up or accumulating in one area. So it is a manual technique. It's done, it looks like I'm frozen. It's done in the areas of the lymph nodes, and it consists of times of pressure where you're trying to milk the fluids out of the lymph nodes, and then relaxation where you're allowing them to fill back up with new fluids and then milk it out again. So you kind of push on an area to push the fluid out and release. You wouldn't release it all the way. I'm just kind of showing you. You would push on the area down and release and push and release to try and allow the fluid to fill back up before you push it out again. Some of the contraindications, you would not want to do manual lymphatic drainage with someone who has congestive heart failure. Their heart is already backed up with too much fluid, so you don't want to push any more fluid back to their heart. It will make that worse. If they have kidney failure, same thing. You don't want to give their fluids their kidneys more fluids to deal with. It will make the kidney failure worse. If they have a DVT, of course, you don't want to do anything in that area to mobilize that blood clot, because once the blood clot moves, it becomes more dangerous. It can get lodged in the lungs, which would be a pulmonary embolism, or in the heart, which would be a heart attack, or in the brain, which would be a stroke, and all those things are pretty bad. Or if the patient has an acute infection, you don't want to move the fluids throughout the system, because that's going to spread the infection. So those are times you don't do manual lymphatic drainage. When do you do it? When is it indicated? Is when there is significant swelling in an area. And if it's throughout the whole body, you will do it throughout the whole body. If it's just in one area, your focus would be more on that limb, but you can also do it throughout the system. The thing that's a little bit different about manual lymphatic drainage is that we start proximal and then we go distal. Now, the reason being, like, let's say there's a traffic jam. If 75 is completely sit still, then all the roads and ramps that lead onto 75 are also going to be backed up, and any side street that is going towards those on-ramps is going to be backed up. If you send more cars down those side streets to get on 75 without fixing the traffic jam on 75, you're actually creating more of an issue. There's no room for more cars, so now everything's getting more backed up. So what we have to do is we have to go through and clear off the interstate, so the main highway, in the body, the proximal area, the main area where the problem is to begin with, to allow more cars to enter, and then eventually the side streets are going to have less traffic if you clear off the main road. So it's kind of the same thing. If you start to push fluid up the arm to an area of lymph nodes that's already backed up, there's no way that it can accept any more fluid. It's already overflowing, and so you create more of an issue. So you've got to start proximal at the lymph nodes, and you've got to push that fluid out and allow that fluid to get drained so that it can accept more fluid coming to the area. So first we clear the proximal lymph nodes, and we still push proximally. We're still pushing fluids back to the heart, but we're clearing them proximally, and then we move down to the next area and push that fluid proximal and clear those lymph nodes so that we can go down a little bit further. So it actually goes from proximal to distal in the way that we are moving our hand down, pushing fluid up. However, all the fluid we're still pushing towards the heart. So our strokes are still from distal to proximal, but we're starting proximally, doing strokes toward the heart, and then we're moving down, still doing strokes toward the heart. So I know that can sound a little bit confusing, but if you do have questions, please let me know. And we do just enough pressure to stretch the skin. So we're not doing a deep pressure. We're not doing a sustained pressure. It's just enough to stretch the skin, and then release just enough to allow fluid to enter back in. Typically, we do about 10 strokes in each area before we move to the next area. And we teach the patient or their caregiver to do this for the patient as well, because it needs to be done at least daily. Ideally, this would be done every day, maybe even a few times a day if possible, but at least every day. And most of the time, insurance won't cover us seeing them every day. So they need to know how to either do it themselves or have a caregiver perform it. Some of our just general recommendations for exercise. We want to clear all the vessels up first by the manual lymphatic drainage before we do exercise. And there's currently a controversy over whether it's best to exercise in your pressure garments or whether they need to be removed. I personally say remove them. The reason being, if you wear them, they will get sweaty, And you do not want to wear a sweaty pressure garment because then there's going to be moisture on your skin, and that will cause more skin breakdown, more damage, more likely to get an infection. Once the garment gets sweaty, you need to wash it. Most garments have to be air dried, so then that's going to be kind of a long duration of taking that off and leaving it off to wash it and air dry it before you can put it back on. So it's going to be a long time before you're able to wear it again, unless maybe you have a few pressure garments and you can just take one off and put the other one on. The only benefit to wearing a pressure garment during exercise is, keeping the swelling from getting worse and just continued use, just increasing the amount of time you have it on. It's also sometimes frustrating or hard to get it off and put it back on, especially in a timely manner. If you have 30 minutes with a patient, it might take them 10 minutes to get the pressure garment off, and they might need your help getting it back on. So it may end up taking half the session to get it off and on, which can be an aggravation. But to me, it is worth it. I'll typically say just come with it off, and then we'll put it on before you leave, or you can put it on as soon as you get back home. It'd be better for them to be an hour without it than 5 hours without it, waiting on it to dry. So that is my recommendation. But some of the talks out there are mixed on whether you take them off or leave them on. With our exercises, we still perform the exercises more proximally to kind of push fluid out of that area before we do more distal exercises, just like our manual lymphatic drainage. And some of the examples of what types of exercise we could do, it's all light, low intensity exercises, including range of motion and stretches. So deep breathing exercises, arm circles, wand exercises, which is active assistive range of motion, heel slides, knees to chest, hip external rotation or knee flexion, ankle pumps. Any of those types of exercises are good for circulation and still low impact. If you do something high impact, you're going to actually increase some of the inflammation in the area, so you want to avoid that. Lymphedema and cancer. Oftentimes when somebody has cancer, they remove the cancer site as well as all the surrounding lymph nodes. So if they have breast cancer, most of the times the lymph nodes in their arm pit are removed, and the reason being, if one of those lymph nodes is infected, it's going to send if it has cancer, it's going to send the cancer throughout the system and cause the cancer to spread, so they don't want to take that risk. The only problem with that is once they remove those, then it sets the patient up to have lymphedema in that extremity. So this patient had a left mastectomy, and then the left arm has significant lymphedema. There's not adequate pathways for it to drain appropriately, and so it's gathering in the arm. With someone who is either going through cancer treatment or has had a recent mastectomy or surgery or anything, you want to, of course, exercise at moderate or low intensity levels, no high intensity levels. You want to schedule their treatments around their chemotherapy sessions. Most of the time they're very tired after chemotherapy. You want to avoid exercise an hour or two before they have their blood drawn. If you know that that's going to happen, then you may have to schedule your treatments around that. You want to do very gradual progress, try and return them to their baseline of activity, and then pay attention to their blood counts, if their platelets are too high or too low, or their white blood cells or any of that. It's contraindicated to do exercise, so pay really close attention to what their blood counts are. And you can ask them if you've been to the doctor recent, has there been any recent changes, just checking on them before you clear them to exercise each treatment to make sure they are safe to exercise. All right, that's all we have for today for lymphatic disorders. We will practice manual lymphatic drainage when we get to lab and get that technique down, and I will see you in lab. Have a great day. Let me know if you have questions.